she was talking a little bit about carpal tunnel on the right side. So we're going to work on that a little bit.
Yeah, I got it from my first pregnancy, and then it never left.
You know, I hear that every now and then. Carpal tunnel is when you have symptoms from here down. And this is the carpal tunnel right in here. Anything that can close this area can cause carpal tunnel, and it kind of pinches the nerve that goes through here. Textbook carpal tunnel, actual carpal tunnel, is symptoms from here down. If you feel anything here, it's not carpal tunnel. You might be experiencing stuff in the carpal tunnel area, but carpal tunnel syndrome is here down. So I hear a lot of people that are like, I have carpal tunnel, but they also have pain in the elbow, the shoulder, and in the neck. And to me, that's coming from the neck. So a lot of times it is coming from the neck, but it does feel a little jammed in here. So we're going to work on it. We'll work up the whole chain.
Yeah, I never knew about going to see the chiropractor to help carpal tunnel.
Yeah, well, you know, I think there's probably other ways that might be better. But if it's like I said, if the things that are closing this area are like muscular or joint in general, and it's not like a weakness type thing or an inflammation type thing, then yeah, chiro would help. But if it's inflammation, that would be more of like nutritionist, naturopath, stuff like that. But you know, if I do a bunch of stuff and it doesn't help, then it would probably more be on the inflammation side.
Yeah.
How's business?
It's good. I'm taking a little break for maternity leave right now.
As you should.
Yeah. But yeah, the second's my last one. So I'm really trying to savor it. Yeah, I'm sure. It's a lot.
Yeah. We're trying for our first.
Oh my gosh.
I know. Using our little Happy Spine CBD cream. And then people were talking about like, you guys can like practice like parenting styles. I'm definitely more like, let my wife be the light, you know, and I'm kind of in the background.
Oh, okay.
Yeah. That was like, it was hard at first to like realize that, but it works out a lot better. So we're gonna take the thumb and the pinky and just pull them out. Again, we're trying to open up there. Good. And we'll just check any of the joints. Good. Pull it apart a little bit. Yeah, there's some crunchies in there. Okay, pull your arm back for me. Again, just trying to open up that carpal tunnel. Good. Okay, now I'm going to start working up here. When you're working on your pots and stuff, are you using this a lot?
Oh yeah, both my hands.
Right side more or no?
Yeah, I'm right-handed. Well, it's kind of the same on both hands.
One of the spots that's related to that carpal tunnel area is right in here. Medial epicondyle right there. So we'll do a little cross friction. What else is new?
Just that. We did a baby moon. We did like a Euro trip in Iceland and France, Paris.
Students that are watching this, I'm basically hitting any muscle that is related to any of the nerves that go down into the hand. So bicep, tricep, forearm muscles, pec minor, scalenes, upper trap, levator, and then we'll hit the upper neck where the nerves come out. So you'll always feel the scaling on the right side too, whenever there's anything going down to the hand.
Yeah, everything feels really tight right now.
Well, you just like gave birth to a bowling ball.
Yeah.
And your body doesn't just go back to the way it was.
Yeah.
That's why pelvic floor physical therapy could really help as well. Probably first rib on the right. How's your jaw?
I still have TMJ.
Okay. So there are some exercises that can help with your wrist. Mm-hmm. If anything, like to me, it felt like your wrist was a little bit more on the unstable side.
Oh, really?
Yeah. So I think some stability could help. And
like a brace?
Oh,
Hi, Soups.
Well, yeah, that would help too. But like learning how to stabilize the muscles to form your own brace,
mm-hmm.
you know, that would be much better. But, you know, if you have to work and your wrist is bothering you, yeah, a brace would help for sure, 100%. But one of the things that happens when you're pregnant is all your ligaments get really loose.
Yeah.
And sometimes they don't just like go back right away. So you could just have really like loose ligaments in your wrist. Mm-hmm. And then that's when like, you know, physical therapy type stuff could help.
Yeah. I did OT for like 3 months for it.
Did it help?
It did help.
First rib.
Whoa.
Beautiful. I'm just trying to stall because I have my personal training session today. And I'm like, my body's so fatigued. I want to just like not go.
I know.
I played soccer last night and it's like not normal for me.
Oh my God.
Beautiful. Okay, another one. External rotators. Right in there. Mm-hmm. Already found a decent spot. And Subi's looking at me like I'm crazy. So cute. My wife has 4 dogs at home in Indonesia, and one of them's a pug.
Oh, pug.
And the pug, he's my favorite. His name's Patapoof.
Oh, pug.
When did I see you last?
It was over a year ago.
Yeah, it has to be. Because today is actually my year anniversary at this office.
Oh, yeah, I haven't been here.
Yeah,
wow.
So it's got to be over a year. She hates me.
Subi?
I mean, I would too. This thing hurts. Stuff hurts. You were developing a baby for 9 months.
Yeah.
It's crazy.
Oh no. Like a relative?
Kinda, yeah. No. Here. Yeah. Okay, kind of jammed in the back, so we're going to use the wedges to open her upper spine. Lift, down, lift, down. Does that feel good? Mm-hmm. Okay, cool. Right there. Good. One. Oh, that was good. Much more open. How's your low back?
I think it's tight too.
Okay. And down L5 is kind of tight. Muscles too. Are you getting headaches at all?
No, I haven't in a while.
So we'll get right under this. Just massage out around the sacrum area. And then we'll give both sides a little pinch. There we go. Doesn't feel good. My neighbor has the biggest, ugliest tree that overhangs and just drops leaves.
Oh, yeah.
Dead leaves every single day.
I know we have that too, a tree over our fence.
And it's like my fur child goes and tries to eat those dead leaves every day and then brings it inside. He's such a boy. Okay, let's check pelvis. Sacrum on the left.
Ow.
What happened?
I don't know.
So the hormone is called relaxin, which causes your ligaments to get really stretchy. And I think that's kind of what's going on in here. Beautiful. Yeah, so bend. Nope. On your side or on your back. Perfect. So ligaments are too loose side to side. The twist cracks in her low back. You know, you can twist all you want. It's not really going to release. So we have to do it up and down. So the pulling stuff is going to feel a lot better. Beautiful. Let's get this hip. Beautiful. Down. Okay. Remember this one?
Mm-hmm.
So let's try to relax the shoulders. Let me know when it starts to feel like a nice stretch.
Yep.
Okay, good. And let me know when it starts to move down to like the shoulder blades. Lift, down. It's okay, Subi. It's okay. She's okay. She's okay. That was good.
Yeah.
That was nice.
Yeah, every time you do that,
Yeah,
it's,
that was necessary.
yeah,
That was
it
needed.
shocks me. Hi, Subi.
Oh, your little dress. Oh, she likes the head scratches.
Stuff that can help. This is 10 pounds. This is way too heavy, especially for me. But it would be holding something with a little bit of weight and just going down as far as you can. And then doing it this way as well. So holding it here and then just going down as far as you can. It teaches these muscles here how to decelerate and how to stretch. Okay? That's like PT type stuff. That's what they would do in PT.
Okay.
So that's something you can try. But, you know, pro tennis players, when they have elbow issues, they wear a brace when they play.
Oh.
But they take it off when they're not playing. So, you know, if you have a heavy day, like building a lot of stuff, wear the brace.
Okay.
Okay? Hey everyone, if you made it this far, I just want to say thank you for watching our weekly video. And if you have any questions about chiropractic care in general, just leave a comment, let me know. Or if you have any video ideas you want me to do, drop it down in the comments. If you made it this far and you're not subscribed, come on, it's free. Can you please just click it? It really helps. Have a good day.